Thank you everyone for joining. I really appreciate hanging out on a Tuesday night with me, especially with no CE credit. But hopefully this topic speaks to some people. I feel like it is a needed thing. And we're going to talk about the implementation of shockwave therapy into your practice. As she said, my name is Dr. Jen Vitucci. I live here in Florida and I'm one of the professional services veterinarians and I specialize in therapeutics here at Zomedica. I've been with Pulse Vet for almost 3 years and had a rehab in my general practice prior to that. So I'm going to do my best to kind of hopefully give everyone some tips and tricks to implement this practice the best they possibly can, implement this therapy. So we all have those stories, right? Where we had something that we were super excited about, or someone in the practice was excited about, and it was either a service or a therapy, and it didn't really take off, right? So that's why we're doing this presentation, because our biggest concern anytime we get something new is really incorporating it into our practice in a successful way. And Zomedica, we want all of our practices to be successful, right? We want to be able to impact the health of our patients, ensure success for our customers. And so hopefully this presentation is going to give everyone some ideas to encourage more utilization. We know it takes a little bit of work on your end and a little bit of dedication to ensure success. So our goal is to sort of hopefully provide a little roadmap and make it as easy as possible. So when we're thinking about the top shockwave hurdles, right, the things that we hear the most, the things that we think the most, the first one is we feel nervous talking about it. So we're uncomfortable recommending it because we're not exactly sure we're that comfortable talking about shockwave. Do we understand it enough to talk about it with a client? We're too busy to even begin to bring something new into the practice. Everyone's busy. Everyone has more clients usually and more work than they know what to do with. We're understaffed, right? We don't have enough people. How can we possibly bring in something new? And then I often hear the line, my staff will kill me if I ask them to do one more thing, right? Because they're already really stressed out to the max in our current climate. The fourth one is I don't have enough of caseload to support this, right? I don't have the clients, I don't have the patients who need it, so I don't really have those type of cases. And the last one is my clients won't pay for that. So we don't think that even if we did have the caseload, that our clients are going to be interested. And so I'm sure there's other ones, but these are really the top hurdles that we hear and we're used to. And those are the things we want to give strategies to combat tonight. So the first tip speaks to that hurdle number one, that we're uncomfortable recommending it. So tip number one is get comfortable explaining and recommending shockwave, right? If we don't understand it, we get scared to recommend it in case the clients start asking us questions. We don't have our speech down. We don't have the cadence of how we're going to recommend it. And so we just, it's not part of our everyday thing and it makes us a little bit nervous. So we want to make it as simple as we can to get comfortable. So let's just review what shockwave is for the vet team, okay? So it's nothing to do with electric shock, right? It's simply a physics term for a high pressure or high energy sound wave. There's lots of examples in nature where this occurs. So explosions, supersonic aircrafts, and lightning and thunder. So lightning is actually an electrical impulse that changes the pressure of the air around it. And that sudden pressure change is what causes the sound of thunder. And when you wake up in the middle of the night to that big boom of thunder, you'll often feel your walls or your windows shake. And that is literally sound energy being deposited in your house, okay? Because I always thought sound was a little bit difficult to understand, but everyone can kind of think of that feeling that they have when there's fireworks close to them, or an explosion that knocks the actors down, or when you have that boom and you feel everything rattle in your house. And that sound energy is absorbed at the cell surface and causes the release of cytokines and growth factors and healing. And we're going to go more into that in detail. But it's just high pressure sound. It's transmitted into the tissues and it gets deposited along the way at areas of density change, or the fancy term acoustic impedance, and microscopically at the cellular level. So there's actually a compressive and a tensile force that mechanically stimulate the cells. And my very fancy term is that the cells squish a little bit. And in response to that squish, those cells release those cytokines and growth factors important in healing. So this next slide is kind of a dramatic example, but I think it sort of helps people to understand that these cells actually feel something when the shockwave goes off. So over here, there's an electrical impulse. We're inside a pool, and these are some balloons also filled with water. And so when this impulse goes off, right, causes a sudden pressure change sound in the water, and you can see it affecting those balloons in a different way. This is a dramatic example, but just kind of a good visual, I think, so that we can understand that when that sound energy is absorbed, things are happening to the cell. And then the cytokines and growth factors released are things like nitric oxide, which helps control pain and inflammation, VEGF for neovascularization, endothelial cells proliferate, tissue growth factors released for tissue healing, osteogenesis occurs, right? And all of these are complicated and we don't need to be able to repeat them, right? We're going to talk about how we say that to our clients, but it's just so that we can have a little bit of a better understanding of what's actually happening. And what's happening is the cells are absorbing sound energy and it's causing them to release cytokines and growth factors important in that healing process. So that's our understanding of shockwave as the vet team. How do we then want to explain that to our clients? And we keep it very simple. Shockwave uses sound energy to initiate the body's own healing process. And that's it. That's often all we need to say. More specifically for our clients, it decreases pain and inflammation, it improves blood flow, and it improves the quality and speed of healing. And that's usually the best that we need to have when we're talking about how to explain shockwave, right? If we are giving a medication like metronidazole or something, our clients aren't really asking us for the mechanism of action, right? They just want to know that it works. So we really need to just remember that we don't need to get that complicated, right? We don't need to be shockwave experts. We just need to be able to give them a broad overview of what happens. The other thing I think it's important to note the difference between is shockwave and laser, because a lot of our clients are familiar with laser. That you have one in your practice, they've had it on their pet, they've had it on themselves, right? So what's the difference between shockwave and laser? So laser uses light energy, shockwave uses sound. And the reason that it's different than laser is the way that sound energy travels within the body. So most of our patients' bodies, just like our own, are made up of fluid, and sound travels really well in fluid, right? It's a very efficient and effective way to deliver energy. So if you are a whale or a dolphin or a submarine, you're communicating with sound and sonar because that sound travels unchanged long distances in water. We're not using flashlights or light because it attenuates, it reflects, right? All sorts of different things happen. It absorbs. And so sound travels differently in our bodies, and it's a really effective way to deliver energy to our target. And that's kind of the biggest difference, right? Sound, light, and the way it travels to the target tissue. So what if we say those things, right? We just use those little tiny words and they want to know more. Don't be afraid to use your resources, right? We can send them to the Zomedica website. We can send them to webinars. We can use the client brochures. We can direct them to different research, right? It's okay to not be the shockwave expert, right? We need to be able to have a basic understanding of it, but it's okay to say, if you want to know more about the physics of shockwave and all the research that's been done, there are places that you can go. right? We're happy to share those resources with you. Here you go, and move them on their way. Don't get so hung up on like, I don't know every single answer that they're asking me. Even more important, I think, is understanding this slide. So besides being able to describe shockwave in just a few sentences, I think it's really important to focus on what does shockwave mean for their pets. So understanding the why of why we're recommending it, not the what of what shockwave is. Because shockwave offers so many benefits, why would our clients be interested or excited to have this option? Right? If you walked into your lobby and asked your clients, hey, are you interested in a non-invasive option that decreases pain, improves quality of life, is non-invasive, can reduce or eliminate the need for oral pain medications, faster healing, no side effects, it's easy to use, client compliance is easy, there's multiple efficacy studies, they would probably be interested, right? So it's just important to, I think, focus even more on the why are we offering shockwave versus what shockwave actually is. And I think that's where you get a little bit farther sometimes with your clients than talking about, oh, well, it's sound energy that does this, right? It's really, hey, we have this awesome thing that we can offer you, and it's going to do all these amazing, have all these amazing benefits for your pet, right? We're going to improve their quality of life, speed up their healing, decrease their pain, et cetera, et cetera. So if you can't remember the rest about shockwave, right, remember the why. Okay. So tip number 1 is get comfortable explaining it. Tip number 2 is we need to strategically implement shockwave therapy. We want to target something specific instead of a shotgun approach, right? There are some clinics who are very good at the shotgun, right? They're ready. They want to bring everybody on board. Everybody's going to be a shockwave candidate. Let's do it. I think it's really easy when we first start to get overwhelmed and almost forget about it even more when we do that shotgun approach. So I think it's important to be specific about, okay, we're going to start here and then we can build on that. So a couple examples of where we can start. So one of them, and we're going to go into more detail, is osteoarthritis. So hip, elbow, LS disease. Even pick a few places, right? Not even everywhere. And newly diagnosed. Injuries. So we can do shoulder injuries. We can do partial cruciates that aren't having surgery. If this is your type of practice, you can include it in your post-op orthopedic procedures. So that's not going to be for every practice, right? It depends on if you do any of those at your GP, if you're all rehab, if you're surgery. But it's something to think about. It's an easy way to start introducing shockwave. And then the last one is wounds. And I like to add that in to any of the above, right? And we'll talk about how easy it is to use on a wound and how it's something, that we can add in and start making money. And this way, if we have this plan, when we see those cases come in or those appointments, we can have our staff sort of flag them, right? Or we can be thinking about it in our mind, like, hey, this is a new hip arthritis. Maybe I want to think about doing shockwave. So it just makes it a little bit easier because we know everyone's super busy. We know everyone's understaffed. We're trying to get through the day. So how do we make it really strategic with our decisions? So as I said, example number 1, newly diagnosed hip, elbow, or back OA. And these could be, your patients that are coming in, your 10-year-old lab that's here for PE backs, but it's slowing down. It's having a hard time getting up and down, and you're noticing some pain in the hip area or pain in the back. Or it's a front limb lameness, right? That probably had some elbow dysplasia 8 years ago and is now coming in for pain in the elbows. So anything that we probably were going to put on or may still a joint supplement. We're going to talk about nutrition. We're going to talk about weight management. We're going to talk about NSAIDs. We might have talked about laser, right? All of those things that we sort of do in those newly diagnosed, start talking about shockwave, adding it in as part of the plan right off the rip, right? So they don't know any different. We just go straight in. It only takes a couple minutes per treatment. You can start today, and then when they come back in for their recheck, you can schedule that before they leave. You can create a package price. So some people have osteoarthritis packages. Some people have shockwave packages, right? It's whatever. We're going to talk about pricing in the future, but it's something that you can easily add in. And again, you can perform it in the room, or you can perform it away from the owner by a trusted technician. So as the doctor, you can diagnose it, you can prescribe it, and then you can go on to your next appointment. And this shows that your practice is committed to this comprehensive and progressive approach to pain management, right? We don't just come in and give you pills. We have other things that we can offer. And I see the question, Julie, and I will get to that one. So keep it up there. So that's a strategy for the first one, right? Is that newly diagnosed hip, elbow, LS disease. When we're thinking about starting on all those other therapies, we're going to include shockwave in it. Second target is we may want to start with shoulders and partial cruciates. Maybe you're a hospital that sees a lot of these, right? Or you see a lot of partial cruciates that aren't having surgery for whatever reason, depending on your income, depending on your ease and accessibility to a surgeon or surgeries, right? All those things. This may be something that your practice sees a lot. And so we're just going to start shockwaving those. Okay, that's where we're going to go first. Again, we're going to add it into the initial treatment plan, right? So it's when we diagnose it and it's not going to have surgery, we go over the options. We can start right then. A lot of places will do a short course of pain meds and then shockwave at the same time. So that way we can start that patient on the path to healing at the first visit. Again, we're going to talk about pricing because there's different ways to do it. But, packaging, thinking about prepaying, just like we kind of do with laser packages, sometimes makes it easier when they come back in the future. Again, treatments is very short, can be done in the room with or without the owner. But it's something that, hey, here's your problem. This is what we need to do. And shockwave's already on your list of things that we're going to add in. So newly diagnosed hip, elbow, LS disease, or we can do injuries, shoulder and partial cruciates. If you are a hospital that does orthopedic procedures, obviously have a TPLO up here, but there's all sorts of other orthopedics, right? Fracture repairs and lateral sutures and MPLs and anything like that. You can just roll it in to your price. Just roll it into the surgical package for every orthopedic procedure. You could reduce the fee for the post-op and the 2-week recheck if you wanted to make it a little bit easier. And this one's the easiest because you don't really even have to have a discussion with the owner if you don't want to. Most people do because they feel comfortable, but you don't necessarily, right? It's just part of the surgery package is it comes with 2 shockwave treatments. And it's a way to get just comfortable using it and get everyone kind of thinking about it, right? It's very minimal extra time and effort required by the staff, and you're going to improve your surgical outcomes. So it's going to give everybody kind of an easy way to roll into starting shockwave. And then the last one is adding in wounds or lick granulomas to any of the above. I wouldn't necessarily suggest only starting with wounds completely for shockwave, but if you want to pick one of the other 3 big categories to start and then have wounds as a side category. Again, easy thing to flag in the computer to be aware of, like, oh, hey, we can do this. And it's often you can just do one treatment. So you can add it into your wound protocol or your lick granuloma protocol. Even hotspots, depending on the location of the hotspot, are something that you can think about. Often you can charge less because it doesn't require as many pulses to treat a wound, or you could charge regular price. But it's something that, again, it's super easy. It's a very specific indication, so we're not getting overwhelmed, and you're going to see good results. Because the other thing, the reason I'm starting with some of these is to build our confidence level with shockwave. A lot of times when people get new therapies, I see this happen a lot. They bring in kind of their worst cases, A+ clients who will do anything for their pet, but they're 16 years old with 87 joints that are arthritic. right? And they're excited to shockwave them. And the expectations sometimes need to be managed a little bit in those patients. Whereas if we pick something a little bit more specific when we start, we can really build our confidence with our staff and with our clients and build some testimonials that will encourage us to use it for more things. So that's the other reason I sort of selected those specific things, so that you can see some improvement. It can get everybody on board. If there's any skeptics, it can get everyone excited, and then we can expand our usage as we move forward. So those are kind of my 4 things. Like I said, newly diagnosed OA in those areas. We can do injuries, shoulders and partial cruciates. We can do post-op, and then we can add in wounds to any of those and see a big difference again. So we can build our confidence level and get excited to start using it more and more and get comfortable. And I think that helps if we have a strategy as well when we start thinking about that hurdle of I don't have the caseload. So again, if we're just thinking about every single indication on the sun, sometimes it feels like no indications. So getting really specific and start thinking about how many of these do I see a week? How many do I see a month? And how many can I add in shockwave to? You're going to get a little bit firmer of a picture right off the rip of how comfortable you can be in using this modality. So tip number 3 is the hardest part and the biggest challenge, which is prescribe it. We feel very guilty sometimes, not every single vet, about charging for things that are non-essential or sometimes new therapies, right? We're all guilty of when we get something new, discounting it or doing it for free to kind of build up our own confidence, which there's nothing wrong with that, right? But we need to understand that our clients do expect us to tell them what to do. And most of them, hopefully, expect that we know what's best, right? And this is much easier said than done. And I'm just as guilty as everyone else of doing that, right? It kind of sometimes depends on the day and the mood I'm in and the client I'm talking to with sort of how good I am at this. But I try and I strive for it. So I'm not saying this as a throwaway because I know how hard this is to do. And I'm really, really guilty of it myself. And the best example I can give is changing our language a little bit. So I have a couple examples of what I mean when we talk about prescribing instead of trying, right? So we need to prevent shockwave as part of the standard of care. So if we're talking about those shoulder injuries or those OA cases, right, we need to just roll it into our language. So example, while we're getting Rossi's joint supplements ready to go home, we're going to utilize the shockwave to help get Rossi's pain and inflammation under control as fast as possible, get him feeling better right now, and he'll need another treatment in 2 weeks. And just making it part of our flow, as opposed to what we all do, and I will do myself, is like, oh, before you go home, do you want us to treat that hip with shockwave? And then the owner's like, well, what's that? And then you say it helps with pain and inflammation. And then they say, how does it do that? Will it hurt? And then we get into this explanation of where we don't really feel comfortable, right? Because we don't feel like shockwave experts. And then we spend a long time explaining it, and then they still don't get it because they think it's a choice, right? And we have kind of offered it like as a bonus item, not really as part of our recommendation for treatment of care. So we need to be, first of all, confident ourselves, right? That we're knowing this is the best medicine for ourselves. We need to be really clear with our words. And I'm so guilty of this, right? Instead of saying, do you want to try, or I think, or anything that sort of creates doubt or deliberation, think about the why, right? We want to get them feeling better right now. We want to get them healing right now, and be really consistent with your recommendations. And this is sometimes true of your staff as well, right? Which when we talk about the staff in general, we need to make sure that everyone is also, proposing a consistent message, because you don't want to walk out of the room and then your best tech is like, man, I wouldn't really do that. I know she talked about it, but you don't need to. So those are all those things that, and I know we've heard some of this before, right? This is not groundbreaking thing, but I think just sort of hearing the language to me makes it so much easier, right? So another example, Rossi has a biceps tendinopathy. We're going to talk about how to restrict his exercise to help him heal. We're going to start him on some medication, and we're also going to start on shockwave treatment today to improve the quality and the speed of healing for this injury. And then just zip it, right? And let them push back if they want to. Versus saying, okay, we're going to start some exercise restrictions and medication. Are you okay with that? You know, and they ask questions about the meds. Are they going to make him sick? No. We can talk about that if it happens. And then, oh, are you okay if we shockwave him too? And then they say, I guess, what's that? How much does it cost? What is it? And then we're back down the rabbit hole of explaining it. And then the owner declines. And a lot of times when I ask vets, because I get asked this question all the time, and I ask all my customers who are really good at recommending it, and I'm just like, how do you get your clients to do all that stuff? And they just say, because I told them that's what they needed to do. So it's like a funny mentality when you have a vet that's really, really good at doing that, right? They don't even know that that's what they're doing. And it doesn't need to be so dramatic, right? It's just that simple shift in language that just includes it as part of our treatment plan, right? The same as when we're doing diagnostics. You know, your dog's drinking a lot, peeing a lot. Okay, well, we need to do some blood work. We need to do some shockwave. It's just going to become part of our language. And then let the client push back, right? If they want to, they can. It's not like we're telling them what to do. They can still ask more questions and have an out if they want to. Tip number 4. So we've talked about how to get comfortable explaining it. We've talked about how to find the caseload, how to talk to our clients and get them to do it, right? Make sure that they're going to be on board and how they're going to pay for it. And then how quick the treatments are and how easy the treatment protocol is, right? Helps with some of that busy and that understaffed, right? They only have to come in once now and once in 2 weeks. And then make pricing simple. This is also the number one thing I get asked about Shockwave is how do we price it, right? How do we structure it? And this is going to depend on where you're at, who your clients are, what type of practice you are, right? Are you a specialty? Are you a referral? Are you a GP? Are you rural? Are you in New York City? But I think a lot of it is making sure that we don't undervalue it, right? And that let our clients push back before we assume what they're not going to pay for, because we need to remember the value of it, right? And also remember the cost of the other things that are comparable to it, right? If we're adding in NSAIDs, if we're going to do supplements, if we're going to change our food, if we have to do, 6-month blood work because we're on NSAIDs, if we're doing laser packages, those things are not free. And a lot of times when you add them all up, you'll be surprised how close 2 shockwave treatments are at your price compared to 12 months of all of these things. So 2 or 3 shockwave treatments versus 12 months of all of that. It's not that much more expensive. So sometimes before you think that, really sit down and go through some of your pricing for a lot of these indications and see how different it would be to add in the shockwave. So there's many different ways to do pricing structures, okay? The easiest, simplest thing to do is all the treatments are one price. There's a wide range, again, depending on where you're located and what type of practice you are. I would say most people are between 150 and 300. I have very few that are any less than 150, maybe one that's 140. And then I have some that are 600, right? Depending on where you're at and where you can push it. But that to me is the easiest, simplest way to start. If I do 2 hips, it's the same price as if I do, every treatment area is the same price, and just make that make sense and make that affordable. The couple other really common ways I do see it though, is that the first treatment area is one price and additional treatment areas are discounted. So if we're doing one hip and we need to do the other hip, first hip is one price, second hip is a different price. And then some people they want to have the first treatment in general be more expensive. and then the subsequent one's cheaper. So they kind of, if we do one treatment, we can sort of encourage them to come back, because it's not going to be $400 every time. It's going to be $400 today and 100 or 150 the next two. So there's no wrong way to do it. I just like to keep it simple. That's just easy for me. I think it's easy for the staff. It's not confusing. And I think sometimes you can make the treatments a little bit cheaper, so you feel a little bit more comfortable because you're just, keeping them standard. I've also seen people where the first, 500 treatments are this cost, and it's cheaper to add on. 5,500 pulses are this cost, and each additional 500 is this cost. So again, there's all different sorts of ways to do it. I think it depends on what you're looking for and what you think you're going to use it most commonly for. That's why for me, I just keep it very simple, so that it's not a constant question of, did we put the pricing in right? Surgical package pricing are often the ones that people discount, but you don't have to. Again, because they're built right into the surgery price. Usually one of them's done while the pet's under anesthesia. So it's a really easy thing to just toss in, not really have to explain too much to the clients unless they ask. And laser packages are usually, again, depending on where you're at, somewhere between 200, sometimes 300, 400 for that package of 6. And most likely they're going to need more than 6 treatments in that 12-month period, right? That's not going to be the only package that they pay for with the laser. So I've often told people, make it, similar to that, right? Make it similar to what they would pay for laser in that 12 months. So that way in your own mind, it makes sense to you what you're charging, and you don't feel as if, you feel nervous offering it to them because you're comfortable with the value of it. And all of these pricing structures, this is the other question, are going to be profitable and have a good ROI. So don't be so stressed or caught up in a specific price in your mind that's the only way to make money. If you price yourself up so much that either you don't recommend it or no one will do it, then you're not going to do any treatments. So really get comfortable with your pricing structure even before you get started, right? Some people do, specials for a day or specials when you first start, and that's totally fine. But then have a good pricing structure and a plan moving forward. And I think the easiest thing to do is just pick a price, and that's what a shockwave is. And then if you want to do surgery a little bit different, or you want to have one wound be a little bit different, but when you start having 20 different prices, it gets really, really confusing. So a very simple ROI is if that average charge is between 200 and 300, okay? And the average use is between 2 and 3 times per week at those prices, the device is paid for in about 12 months. So you don't have to use it excessively 18 times a day on every patient to feel like you're getting a good ROI. Obviously, the more you use it, the faster that number is going to be. But it doesn't really need to be more than that to make it profitable. And then your ROA after that device is paid off, gets much, much, much higher. But to have it paid off in 12 months, I think is a very reasonable thing. And I was seeing talking superficial laser versus high intensity laser treatment. And those lasers is talking about like a class 4 laser that you're going to do those 5 or 6 treatments, right, as kind of the standard. I know there's, all different types of lasers and different treatment protocols, but that's sort of the one I'm speaking about most specifically when I'm talking about the kind of that 6, the 3 the first week, 2 the second week, and then 1 every week thereafter. If you use financing, if we're talking about ROI, then you only need to use it 3 to 4 times per month to be profitable. So it's not nearly as difficult to be profitable, I think, as sometimes it seems when people first start thinking about adding in shockwave. And this is per area, not per patient. So if you use it on 2 dogs, with one with 2 hips and one with an LS for that week, then you've hit your amount that you need to hit that ROI of about 12 months. So the last thing that we're going to talk about is, I would say, the other kind of big question I get, where people are like, are we going to get marketing support? Are you going to help us advertise it to our clients? And the answer is yes, but it's really the last tip that marketing comes in. Everything that we've talked about for the last 30 minutes is behavior change, right? It's thinking of specific cases. It's changing our language a little bit. It's using our clients and appointments that we already had for the day. We didn't have to, advertise it and get people excited about it and have them come in special. Okay. We're going to talk about doing that now, but all of that before was just changing our behavior. So this is where we actually talk about sort of marketing internally and externally in general, and how to be a little bit successful at that. But this is a smaller part of the success than we normally typically think that it's going to be. So the first thing is we have to get our staff excited. Okay. So we need to let those who want to treat their pet. So you can either utilize your sales rep and their trode, or you can allocate some funds from your trode to allow the team to treat their pets, right? If they feel comfortable, if they see some sort of success, if their noise phobic dog tolerated it, they're going to go tell that story, right, to their client, to your clients when they're in the room with them. So figure out a way to let them treat things that they want to treat so they can tell good stories, right? Find a shockwave champion. If there's someone in the practice that's super excited about it, right? Let them educate the rest of the staff. Let them educate the clients that you want. Let them be in charge of some of the social media, something like that, so that they can get the other people excited. Educate, educate, educate. So spend time making sure everyone's comfortable. Even if that's 30 minutes, 20 minutes at a staff meeting, having that same conversation that I just had, like, do you feel comfortable with a couple of these questions? How do you feel? All those kind of things. So, make sure that they have the same comfort level that you have, at least for the very, very basics, like we talked about with the walk. Celebrate patient successes. So find good stories, right? Even if you did, treat a dog that everyone was super excited about, or we can video before and after, or have the owner video before and after. You don't have to do anything. Owners love to take pictures of their dogs, right? They can't wait. So, make that part of their treatment package and discount it a little bit, but find something that is exciting and a success, and then make sure to share that with the whole team, so that the whole team is like, oh my gosh, did you hear about, how great Rossi did when they treated him with Shockwave, so that they don't get scared of it, and make it fun. And then some people, similar to when we bring in, right, some other new medication, where, sometimes we'll have a list, right? And when we get to 20, everybody gets a Starbucks, or everybody gets, lunch, or a $10 gift card, or something like that, that sort of, gets it first and foremost in the staff's mind. Clearly, we don't want to use it willy-nilly, but we want them to sort of be thinking about it. And maybe if everyone's, helping the doctor say, what about this? Get the clients excited. Okay. So a couple different ways. We're going to talk about the website first. The website's great for new clients, but probably your existing clients are not spending a bunch of time going to your website. So it's nice to put it on there, offer it as a service. You can put some before and afters, right? If we want to use this gnarly wound photo that I showed earlier to give people an idea, or put a testimonial on there, right? Here's an example. We're not going to read it, but something that's just on there all the time, but it's not very interactive, your website. It's just really offering the very basic new part. Social media and in clinic are going to be your most interactive, quickly changeable things. So social media, make sure you do a bunch of different posts, right? Some of them are fun, some of them are educational, some of them might link to our information so that you can see the webinars, or they can learn more about Shockwave. We want to update that regularly. Obviously, if people are commenting, people have questions, we want to make sure that we're interacting with them. And then don't forget about the power of your in-clinic marketing. You can do the same before and afters. You can do those pictures. You can say buttons that ask me what PulseVet is. You can have posters. Anything in your own clinic that when they're sitting in there getting their food, it makes them think about it, right? Or they're sitting in the exam room and they see a photo of it, it makes them think about it. Maybe not for this cat that they're in with, but maybe for their other dog. So that can be meaningful when there's a lot of time for them just sort of hanging out in there. And then you can market to specific clients on social media or in the clinic, or you can do emails, right? So you can, if you run a report on who's on Rimadyl, who's on Previcox, who's gotten lasers, who's on Dosequin or whatever supplement that you use, you can send targeted things to them if you want to, simple emails, super easy things. You can do promo months, you can do promo days, special packages, you can offer referral programs, right? And this is the more, I think, these are all the more time-intensive, deliberate things that you have to think about, right? Which is why I say it is a smaller part of the success, but still important. But if we're kind of doing all the other things we talked about first, hopefully we're just internally creating our own client base that's going to be interested, and then it will start spreading. And then you can move to all this sort of in-clinic and social media marketing and get those clients who maybe weren't going to come in till June, but hear about Shockwave and want to come in earlier. So you can do some targeted stuff as well. And these are the things that Zomedica can help with, right? We have social media examples. We have some sample emails that you can use. If you get referrals from other hospitals, we have sample referral letters to kind of help at least take some of the work out of that. But those are the three things. I think getting the staff excited, using your website just to announce that you have it, and then using your social media and your in-clinic to really be your main marketing sources to get people. But hopefully we've done all the other things so that we already have a pretty strong client base, patient base, and we're starting to build some of that success and comfort as they move forward. Okay, so just to kind of sum it all up, right? We want to understand the why. I think that's the most important part when we're talking about client communication. Why are we offering this? Why did we want to get a Shockwave? What is exciting about it? And how is it going to benefit their pet, right? Are we going to make their pet feel better sooner using Shockwave than anything else? And then we get excited. Pick some indications that you want to focus on to get started. Some clinics do great with a shotgun approach, and that's amazing for them and don't change. But for most of us, it's easier to pick out a few things that we're really going to target in the beginning. And we can go through our appointment calendar and start flagging those appointments to start talking about Shockwave. Changing our language just a hair to use it more as a standard protocol instead of offering it as a bonus item. Just really make it part of the conversation that whenever we're doing these things, we're going to do Shockwave too. And not feeling like, you're pressuring them or selling them, just making it more part of standard of care than that bonus item. Keep it simple with the pricing. That's my advice. There are all sorts of great ways to do it that work for clinics. So there's no wrong way to do it. I just think when you first start, pick a price, go with it. And then the marketing is the last piece of it. And that's really going to be your targeted social media, your in-clinic, and your website. And really just trying to market to your own clients aside from a routine appointment to try and create some more appointments.